It's Dr. Tamara Beckford with your caring doc, Telemedicine Urgent Care, and we are here today to go over COPD. That's right, we're going to talk about the lungs, breathing, so that we can be better, we can get some nice air, understand what's going on with those of our friends, family members, or anyone who has COPD, so we can kind of understand their plight. As we say, this is all medical information. We're not sitting diagnosing anyone, right? We just want to provide great info for you to understand what's going on in your body so you can make great medical decision, right? So I'm glad that you're joining us today. Let's get COPD. So, COPD is an inflammatory disease that leads to obstruction of the air flowing from the lungs. So, it's actually in the name. C, chronic, O, obstructive, P, pulmonary, mean that it's in the lungs, D, disease. Chronic obstructive pulmonary disease. That is COPD, right? So, now, in order to understand what occurs when we're having chronic obstructive pulmonary disease, how about we talk about when we're just having our normal breathing flow, everything's good, right? So we have the air, you either breathing it in through your nose or through your mouth, but either way, the air is coming in and it's going down from the back of the throat, going down to the trachea, right? Let me see, I'm going to put a little pointer on. So it's going down to the trachea. And then from the trachea, it starts to go down to the bronchi. So you have the left and the right main stem bronchus. Together, they're called bronchi. And then from that, it breaks down and goes into the bronchioles, which is the smaller portion of the bronchi, right? And then from the bronchioles, it goes over into the alveoli. So the alveoli is kind of almost like that terminal portion, right? The alveoli is where the gas exchange occurs. When we say the gas exchange, it's what we're talking about, the oxygen on the carbon dioxide. That's where it occurs, in the alveoli. So with that, when you're breathing in your air and it goes all the way in and it goes down to the alveoli, you breathe in that great oxygen, right? And the oxygen just kind of shifts over, and then the carbon dioxide that needs to come out shifts out into the alveoli. The alveoli recoils, and then it goes out, right? So oxygen comes in all the way down, trachea, bronchi, bronchioles, alveoli, shifts over, and then the carbon dioxide that's in the capillaries shifts back with a recoil into the alveoli. Alveoli kind of recoils because it's elastic, right? And then all the carbon dioxide comes up and we breathe it out. That's the natural way things go. So there shouldn't be anything blocking. We shouldn't have any type of obstruction. Things should just, and right? That's our natural. So now that we know what's supposed to happen, this is what's happening with those who are suffering from COPD. So there are a couple forms of COPD. So you have the chronic bronchitis, and then you have the emphysematous form, right? Those aren't the only ones, but those are some forms of it. So with the chronic bronchitis, that airway, remember we talked about the airway and the bronchioles. So that's what you're seeing this picture, the bronchi, bronchioles going down, and then the alveoli. So you have the nice healthy airway where we, right? But when you have chronic bronchitis, you start to develop an inflammation in that airway. And because there's all that inflammation, irritant, the body's, trying to flush that out, and so it starts to produce excessive mucus. So that excess mucus now starts to cause an inflammation and the narrowing of that airway, right? So it starts to get narrow. So when you have the airway that's narrow, how much oxygen or carbon dioxide can really pass through that passage? So think about it. It's kind of like a passageway, right? When you have a wide passageway and we have like 5 or 6 people trying to rush through at the same time, they can all make it through. However, if the passageway gets narrow, all 5 people can't make it through. You're going to have to start doing either like a single line, or some people is just not going to make it. That's kind of what happens when that area becomes inflamed. You're just not going to be able to pass through, especially the amount of air that you need at the same time. So that's part of one of the areas where you're having that blockage, right? Next, now we're talking about the alveoli. So our alveoli with chronic obstructive pulmonary disease, when you're starting to have like a lot of irritation, the alveoli starts to break down. So that nice elastic portion, that nice and recoiling, because it's broken down, it can't really do that recoil, right? And because the area is scarred and getting irritated, that oxygen, doing a little two-step to the left and the carbon dioxide trying to do a two-step to the right, that doesn't end up happening again. And because of that, you start to have some trapping of the air and then that person is just not able to exchange those gases as well, right? Because the oxygen can't make it through, carbon dioxide can't make it through that air because it's all irritated or scarred. So that's one of the issues with emphysema. So now let's move on. Bronchiectasis is another thing. We're talking about the airway, nice and healthy. You can also have bronchiectasis, which is not only just is scarred. So instead of this one being scarred and narrow, it's filled with all this mucus because the body's always trying to filter itself out. But if it's just like constant irritation, it's just producing excessive mucus because it can't just filter out that constant irritation to that area. The area is widened, but things are getting trapped and it's filled with a lot of mucus. So you'll hear that wet cough, that you've all heard someone that has that cough and it's just like that, and it's just rattling and it just wet. They can't really get all of the phlegm up all the time. So that's part of what bronchiectasis is. So what are the symptoms of COPD, that chronic obstructive pulmonary disease? So because of the way COPD is, we talk about you can have wheezing. Now, why would somebody wheeze? Remember that airway, that passageway that we talked about? That passageway was nice and wide, but then now it gets narrow. When it gets narrow and the air is trying to pass through it, then you get that whistling sound, right? And that's the wheezing. When that person is either they're wheezing trying to exhale, trying to get the air out, or they wheeze when they're inhaling, trying to get the oxygen in. So you've all heard people who have had wheezing, right? So that wheezing is because that airway is inflamed and it's narrowed. Then chronic dyspnea. Dyspnea is the medical term for shortness of breath. So they're just always short of breath, right? Moving around and because they have that chronic obstruction and there's always that irritation. The oxygen, that gas exchange is not really occurring as well. As we mentioned in the alveoli, especially those with emphysema, those who have the bronchiectasis, all that mucus is plugging up the airways. So they're just constantly working harder to breathe. So you're going to be short of breath, right? Now that coughing and sputum, we talked about that excessive sputum in the airway, the phlegm, and you're like, that wet cough. You hear that cough, that wet cough that occurs. Those are some of the symptoms of those with COPD, that chest tightness. Why is that chest tight? Well, the air is trapping, right? That air can't make it through, so it's just trapped inside that chest. And so that person is just, and it's just tight. It can't really get that air out. And all of this, of course, will eventually, when you're at the late stages of COPD, a lot of people sometimes become very tiny and they have the weight loss, and you see they're very petite and or they've lost a lot of muscle mass and they're just very tiny. So you'll start noticing that. So what are some of the causes of COPD? So the number one cause of COPD, especially in the United States, is from tobacco smoking. So if you think about that natural way that you breathe the air in, and we talk about it goes down into the lungs and into the bronchioles, the alveoli, when all of that is just that tar and the nicotine and the tar, especially from the tobacco smokes, after years and years and years of doing that, you're going to cause that inflammation in the airways. We call that bronchiectasis and all that phlegm. And you'll also end up causing the scarring to the alveoli. So that gas exchange, that oxygen and carbon dioxide two-step, it makes it hard for it to occur, right? And the air starts to trap, and then that person will start getting that chest tightness, right? Another thing is chronic exposure to chemical irritants, such as those who work with chemicals on a consistent basis, if you're not wearing your mask or your protective gears, and you're just like, oh, it's just easier to just do this really quickly without it, and you're constantly inhaling those fumes will irritate the airways and do the same thing that I just mentioned, and scarring the alveoli, scarring the airways, and then you'll end up with COPD after many, many, many years of constant exposure. Now, asthma is an irritation of the airways. So if your asthma is uncontrolled, not those with controlled asthma, the likelihood of someone who controls their asthma with their medications for them developing COPD is a little bit less. However, it's not zero, but it's just less. However, if your asthma is uncontrolled and you're just constantly in a flare-up phase, remember, if your body's flaring, then it's going to try to keep repairing itself, right? So if it's constantly in that flaring phase and having to try to repair itself, then the areas are going to start to become scarred, and the same thing will occur. Scar in the bronchiectasis, scar in the bronchioles, the alveoli, and then you can also develop COPD. So similar things. And then there's this other factor, which is a genetic factor, which is called alpha-1 antitrypsin deficiency. So that is just someone who unfortunately is born without that particular protein, and therefore they're susceptible for developing the scarring in the lungs and developing COPD. So that's not anything that you have control over. You're just born with that one, right? Okay, so with the COPD, as we mentioned, this is the normal and alveoli. See that nice little honeycomb, and that's when the two-step exchange occurs. Oxygen, like, all right, carbon dioxide said, okay, all righty, I'm heading out, right? But when you have the scarring, then that's not happening. With the COPD, with a chronic obstruction, with the excessive mucus, then you're blocking all that air trying to come out. Now, how do we diagnose COPD? So we have a lung test, which is called a spirometer test. It's a pulmonary function test, and you use a spirometer. So spirometry, as you can actually see here, this is a spirometer. So that person is basically blowing out air into that spirometer, and it's testing and trying to calculate if how much air, and if that person's lung capacity, if they've emptied out all the air, how much air is still left within the lung, and it does this calculation in order to determine if you have a COPD, right? Another thing is that you can get it by testing by the chest x-ray. It can show if you're having the scarring, the alveoli. A chest x-ray is most likely going to be seeing this more in like the later phases, right? And then a CAT scan. A CAT scan is a little bit more detailed because the scan is kind of like scanning all the way down. So you'll be able to see the earlier signs with the CAT scan of COPD, and of course any sequelae that can happen for someone who has COPD. Now, what are some medications that are used to treat this? I mean, we have some people who are really suffering with this COPD, right? Now, if you've seen my talk on asthma, then you'll notice that some of these medications are similar to the ones that's used to treat asthma. So the biggest thing is that you're trying to reduce the symptoms. Once you have COPD, your lungs are scarred, the area is scarred, so the likelihood for you to really reverse everything is going to be less. What we're going to do is try to reduce your symptoms, right? And try to prevent you from moving to the next phase by doing all these things. You do your lifestyle modification. If you're a smoker, you're going to stop smoking, and you're going to try to do healthy things in order to keep that function of the lungs as best as possible, right? But if you're having COPD and you want to try to prevent a flare-up, so what you do, you have some short-acting dilators if you do flare up, and you will probably have heard these names. It's the albuterol, which is the ProAir, the Atrovent, ipratropium. Those are some of the medications that's used when you have an acute flare-up. So an acute flare, sometimes people have it when the seasons change, right? It's winter. It's viruses. They're coming around. That person caught a cold, boom, next thing, their COPD starts acting up. So that's when they start using these bronchodilators in order to reduce these flare-ups. So those are the short-acting ones. And then we also have some long-acting bronchodilators, right? So those are like your Spiriva. So your long-acting bronchodilators are the ones you're going to be taking on a regular basis. It's not going to use for an acute flare-up. You're going to use that to try to prevent your flare-up. So you're taking your medications on a daily basis in order to prevent a flare-up of your COPD. And then you also have some additional meds. There are some inhaled steroids, right? So like your Flovent, your Pulmicort. So some of these are probably some names that you've heard. So the inhaled steroids, you're trying to use these to prevent a flare-up. So these are your preventative medications. And then there's some combo meds. The Symbicort is a combination med. So what is it a combo of? The Symbicort is a combo of steroids and the bronchodilator, right? So it's combined and just trying to help to prevent a COPD flare. All right. So, what are some complications of COPD? I mean, when someone has a chronic obstructive pulmonary disease, we already said the lungs are a little scarred because of the chronic irritation to the lungs from whatever it is that brought on the disease in the first place, whether it's through smoking or chemical irritants because of an occupational hazard or so on. So, because of the area on that lungs is chronically it's scarred, it makes it susceptible for you to catch infections. So that's why those with COPD, they're always encouraged. Your flu season, go get your flu shot, right? Because you're more at risk of developing infections. You're more at risk of developing a pneumonia. Those who have those mucus, if you think about it, the mucus is basically like thick fluid just hanging out in the lung area. Think of a water that's stagnant. If there's no flow and the water is just sitting there, that water is more likely to harbor bacteria, right? It's similar with that, the mucus. The mucus is sitting and it's just sitting in those lungs. So it's more likely to harbor bacteria. And that's why they're at increased risk of having infections, right? Next, you can end up with the blood pressure being elevated in the pulmonary arteries. So if you think about it, that airway is tight and that blood is trying to flow through. So the airway is always tight and there's a lot of persistent pressure. So that pressure starts to build up on the arteries, backing up into the lungs and increasing. That's a different type of blood pressure that's called pulmonary hypertension. So that's hypertension in the arteries in the lungs itself. So it's not in your arms and all, it's really within the lungs. So that's pulmonary hypertension. That is can occur when someone has COPD, especially long-standing, right? Another thing, we know that those who have COPD are at increased risk of developing lung cancer. That's right, because the body, like we said, is always trying to repair itself. After a while, if you really think about it, there's always going to be a damage, and then the damage can progress, and then you start to have additional factors so that can occur, leading you to developing cancer because of this persistent scarring to the area and the cells become damaged, right? And then if someone has all of this, they have COPD, they're persistently struggling to breathe, their lifestyle has changed. They can't go out as much as they once could, especially if they end up with the flare-ups that are so persistent that even using supplemental oxygen or any particular aid, they still are not living that type of lifestyle that they're used to, then that can lead to depression. So depression is another complication of COPD due to the alteration of that person's lifestyle, right? So I hope this all made sense. I know it's a lot. It is a lot, and there's a lot more. That's the thing about it. COPD, there's so much more, but I feel like this would be a great intro into COPD, what it is, how it's diagnosed, what happens within the body so you can understand what's going on, how are some of the treatments, and then obviously what are some of the complications. If you like this info, let me know, leave a comment, share, subscribe, let others know what's going on. I look forward to providing another great topic next week. I love you guys for watching and thank you guys for your support. I will see you then. All right, take care. Bye-bye.